So I started this research as a doctoral student at the University of Michigan in the psychology department. And so I was listening to one of my doctoral advisors give a research presentation on some of her work, which was focused on a psychological phenomenon where people have a tendency to give information to others that they think they'll like. And this is an effort to engage in relationship building with that person. And so it really made me think about a situation where somebody was giving information to a Black American and how they might rely on racial biases or stereotypes, and the potential backfiring effect of that. It was a really interesting kind of experience to read about health disparities, and I became really passionate about the question in terms of thinking about the ways in which targeting health information to Black Americans might backfire. Black Americans make up about 13 to 14% of the US population, but they account for about 42% of new HIV diagnoses. And then in contrast, white Americans make up about 60% of the US population and make up about 29% of new HIV diagnoses. So we see this really large gap where Black Americans are disproportionately affected by HIV. And interestingly, these numbers haven't been decreasing over time. And so the question arises, why are these gaps so persistent, and despite our efforts, intervention efforts to try to reduce them? The issue comes in when we are targeting based on marginalized identities, because that can activate somebody's belief that they're going to be devalued or negatively judged based on their identity. And so I think that's the context that we need to be mindful about, is when people feel targeted, like they're being stereotyped, have assumptions being made about them based on that identity, such as race. So I'm really wanting to change the way that the information is delivered to patients. And so focusing in on the way that doctors are trying to communicate risk to Black patients and ensuring that they're doing that in a way that's not going to make their patients feel like they're being stereotyped or like they're being judged based on their racial identity. And so again, I think this is a context where linking these specific identities with information can be problematic, and it's not there for all identities, but specifically when these identities have been stigmatized in our society, that can make it very consequential and produce these negative responses.